and of course move to mobile telemedicine services once smartphones are more convenient, which in the United States, that is one of the primary highways for telemedicine and providing those services. Thank you for the question.
Dr. Mansa, I think there was a question about the sample population you were relating to. I think there were a number of people who opted out of telemedicine. The question was why? Was it? Someone missed the answer. So we may just want to say something short.
Good morning once again. So we say the reason for some clients not accepting to be scheduled for a telemedicine interaction was their fear, or they just did not accept the process. The process would be explained to them that this is, you sit in front of a computer monitor and this is what will go on, and yet they still did not accept that. So that was the major reason for 37 clients opting out.
Ladies and gentlemen, I think our plan was that we have another round of questions. I know there are 3 companies lined up to say something, but I think we are more important than the companies. So, Dr. Paul, let's take another round of questions.
Okay. We can start with you.
Thank you so much. Mali Lwemuhuma again. This time I want to ask IHM, having inspected SmartCare Plus and knowing that it's developed with React on the front end, I wanted to know, is SmartCare Plus open source? And how can we access your APIs? Thank you.
Thank you for the presentation from HIM. Just a question for them. How is the backup done for SmartCare Plus? Because you have some facilities which the computer was crashed and they were not able to retrieve their backup. Thank you.
Thank you. Nicholas Mole is my name. The question goes to both. What are your protocols on data breaches? What are your protocols on data breaches? Thank you.
There's another hand.
Good morning. My name is Nancy Kasongo from Levy. My question is to IHM. I wanted to find out if there's any plan to also include surgical conditions and trauma into your registry, or maybe if it's already there, would like to know if you can give us more information on that.
I think we can take up these questions. There's one last hand right there behind you.
Thank you so much. My name is Gift Zimba. My question goes to SmartCare. Is it possible to interact a visual session, or to program into SmartCare a visual session where the clinician can interact with the patient without the use of a ball pen, where let's say here is a patient who comes and then there's a clinician who wants to actually take history. Is it possible to integrate that so that information is collected as it is between the clinician and the patient?
So one last question, just on the extreme left.
Good morning, Zambia Collins from Levy. My question is with regards to the telemedicine. I just want to find out their target market and what can be done for people that are in the rural aspects of Zambia. Okay, with regards to, we know that they don't have much access to internet. Yeah, but then telemedicine, I think, offers the option of cost effectiveness and also accessibility to a practitioner without having to have expenses to go to the health facility. Thank you.
Thank you. Presenters, IHM? Thank you.
Thank you for the question. So is SmartCare open source? We are moving towards open source platforms to reduce the cost of maintenance. So for example, there's a new version that we've been working on that is going to be built largely with open source tools. But just to give you a sense of how we're moving in that direction. So for the data warehouse, we actually have the visualizers in place already. We were running them on Power BI, which, you know, the licensing is not cheap. We've now changed. We've moved to Superset, which is an open source platform that's used by all the top companies around the world. But the philosophy is to move towards open source to make it easier for government to maintain. How can I access the APIs? It would depend for what purpose exactly, but what we've done is we've built an API manager to allow SmartCare to interoperate. So the thinking is that we want to, as I said to you, we want to change it from a data collection system to a system that facilitates patient care. So the future really is a point of care system. Now at point of care, there are other systems. For example, if I'm a patient that has got kidney failure and I need dialysis, right? So your dialysis machines are digitized. So if I have SmartCare, can it interoperate at the point of care with those kinds of diagnostic systems? So what we've done is, in anticipation of that kind of situation, is to build an API manager that will allow for that kind of interaction. So I think it's just a matter of getting in touch with us. We can make those APIs available for whatever system that you want to build. So the way we are seeing this is that SmartCare is going to be the primary core system for healthcare services, but the data warehouse really is what is going to revolutionize the way we work with data in the healthcare space, because one of the things, for example, that we've heard from our minister is that when can our citizens, using their phones, access their information? And that's where the data warehouse comes in, not SmartCare. SmartCare is for the clinicians. That's how we see it. But then for health information to be in the hands of our citizens, the data warehouse is the solution that will give that. So what we're doing is to democratize that space by then letting everybody know, especially the developer community. So we're working with Bongo Hive actually to start a series of hackathons that can let developers then begin developing those kinds of apps, so to say, so that then we can start seeing these kinds of things in Zambia and not just read about them on the internet about other people doing that. So I think potentially in the next month or so, you should hear announcements for the first hackathon that we're going to then announce that will create those kinds of opportunities. Backup for SmartCare Plus, our servers are at Infratel. The law is clear, the New Information Act. All public data must be held in Zambia. So that's where the data is held. Infratel has got its own backup environment around the country. So if we're going to have a system downtime, or rather if servers are down, then the other backups around the country can kick in. I'll talk about protocols on data breaches, and maybe perhaps Morehouse can also comment on that. I'm not so sure at the same time, or maybe you'll speak to those later. Okay, so in terms of protocols on data breaches, we've had two situations where NAPSA was breached, Bank of Zambia was breached. At the same time that was happening, our servers were really under massive pressure, but we've put in place very, very strong cybersecurity measures to do that. But that said, we do have protocols in place, starting with government itself. When such a breach happens, whom we report to immediately, in terms of what that breach is, the extent of the breach. So what we've done is, in terms of what is front-facing for people that are going to work with apps, what we've done is we've separated patient-level information from just general medical conditions. So the one that was under pressure, the servers was the one on medical conditions. So the patient-level data, that one, we don't allow it. Our network is a VPN. We don't break out to the internet. So really, for somebody to break into our data, it has to be somebody within the facilities to do that. My time is up. I would like to give my colleague. So for those other two questions, handwriting to text, we're working on that quickly. That's something that we actually want to introduce, but that one is device specific.
Technology is secure. When it comes to rural access, basically the more remote, of course, as we said, we work with the Ministry of Health, Zamtel, and others to make sure that we're having that broadband VPN access in rural communities. Of course, you do need that connectivity, but those cases or those units can be put anywhere. You can imagine that the clinical officer could be at UTH, but they could be, in Lusaka, or they could be at a local hospital or clinic here in Livingston, or they could be in another country to provide that service that's needed to that patient. But you do need remote tools like those stethoscopes that can connect to those cases. Otoscopes can connect. Electronic, EKGs can be done on those cases. There are multiple tools that we could provide those services. So mainly rurally, the cases can be there, but you need the connectivity. You need the tools to access services so the clinician can actually get the information they need, or have a physical exam along with an aide with the patient. But they can be put anywhere as long as we can have that connectivity and get the patient in front of the camera. Thank you.
A big hand to our colleagues, ladies and gentlemen. There's a lot more to say about telemedicine, and I hope that after the drug dealers have said a few things, HPCZ will say a little thing about regulation. So I would call on Karibu to come and tell us something about who they are and what they are selling. But before Karibu comes, just to announce that the National Heart Hospital has set up a consultation center. So those of you who fear doctors, please, this is the time to see a doctor. Have your heart checked out. We are starting from as little as just blood pressure checks, but they are able to do random blood sugar as well. And they are doing ECGs and echoes, echocardiograms. So if you please need to have an echo done, just go to room 3406. So they are set up here at room 3406. Can assure you they are all well-registered practitioners. And they are under our close eye. Obviously, HPCZ is here to make sure that you get the best echo that you can have. So please get there. They have operating hours, 8:30 to 12:30 in the morning, then in the afternoon, 14 to 16:30. Today and tomorrow only. So please, let's get to the National Heart Hospital and get a service from them. Karibu. Karibu Chemist. Can they please come? All right, there comes our nice lady.
Good morning, everyone. All protocols observed. My name is Memory Jemwa, and I'm coming from Karibu Pharmaceuticals, specifically representing MCure. And I'll be taking you through a few of our products that we have, some known to you, but for those who do not know, this could be an opportunity to know them and, yes, how you could use them best for your patients. So you can run with me through the slides. I don't know, I'm unable to see my slides from here. Can I move the mic? Thank you. Yeah, okay. Like oncology, renal, cardiology, gyne, and general segment. So we have chiro products like Asomex. So this basically contains S-amlodipine, 2.5 and 5 milligrams. So the 2.5 is equivalent to the 5 milligrams racemic amlodipine, and the 5 milligrams S-amlodipine equivalent to the 10 milligrams racemic amlodipine. So there's basically a video that I'll be playing so that